going to be talking about something obviously that's completely different. This will be behavioral, and although I will mention physiology, it will be basically to tell you that we really don't have any physiological underpinnings for what I'm going to be talking about. So my only conflict is consulting for a pharmaceutical company, which is not relevant here. I got interested in the concept, in the problem of fatigue in Parkinson's disease many years ago when I encountered a patient who was a relatively young patient with Parkinson's disease. He was about my age at the time, and his Parkinson's was not severe enough that it interfered all that much in his life in the sense that his motor dysfunction didn't keep him from working in a full-time job. And he said he did his job, well enough. It was not a problem, but by the end of the day, he was just so tired, fatigue tired, not sleepy tired, that he couldn't do anything. And that he would come home from work, and he would just lie on the sofa until it was time to go to sleep at night, and he didn't nap during the night. But he was just tired, he was just fatigued. And I got interested in this and started asking my patients about it, and it turned out to be very common. I like to start when I talk about fatigue by showing this slide, which is directly from my email. There was an email I got totally out of the blue. I am a 74-year-old man. I've had Parkinson's disease for 3 years. I can live with Parkinson's. Not great, but livable. But the fatigue is unbearable. As all my life I was full of Superman energy, now I'm only good for about an hour or so at a time. And between the lightheadedness and the fatigue, I'm wasted. I take 1.5 pills of carbidopa levodopa 3 times a day. I take 200 milligrams of Provigil, which is modafinil, and a bunch of pills like NADH. I exercise as best I can, and I follow eating rules. I've been told to go see a shrink, that is a psychiatrist, for those of you who aren't familiar with American jargon, and start on antidepressants. I don't think I'm depressed. I'm retired, and no wife or things to stress me out. So I've been told fatigue is one of the 3 major problems of having Parkinson's disease. Most of the times I'm horizontal. I was told you gave a talk on this problem. Unfortunately, what he didn't hear, because he wasn't at my talk, is that, like everybody else, I don't know very much about fatigue. It's a common problem, but it's actually a very complex sort of problem. And fatigue, as I'll discuss in the next few slides, is related to a number of different types of behavioral problems that are all, unfortunately, very common in Parkinson's disease. And as Dr. Isaacson said at the beginning, something that we in the Parkinson's field really didn't appreciate until relatively recently. And I'm going to give you some examples here of apathy, which is related to fatigue. Apathy, of course, is a syndrome where people don't care, but it's also an amotivational syndrome. By not caring, people aren't motivated to do things, and that's often perceived both by the patient and by others as being related to fatigue. So these are common sort of examples. A 73-year-old man with severe apathy, he denies depression, and that's very important because it's very difficult to distinguish apathy from depression. But he spends his whole day without getting dressed. He sits on the bed, he watches TV, or he looks out the window. A different sort of scenario is a middle-aged man, 55, with intact cognition. This is a real case of somebody who complained to me, that he is bothered by the fact that he just feels this tremendous sense of inertia to do the things that he wants to do and is capable of doing. So here's a patient who feels, he describes as apathy, as not caring, although he really does care, and he has motivation but doesn't seem to have the energy to do things. And he perceives this as apathy. Probably a most common sort of scenario among these the patients that I see would be a man who's stage 5 with Parkinson's, has dementia. He doesn't speak at all unless spoken to. He can't really do anything for himself, but he doesn't complain. And if you ask him how he feels, he says he feels fine. And it's the family that complains because the person isn't motivated or interested in anything. And typically what will happen is this is a patient who sits
and enjoys particularly, say, having his grandchildren come over, but he enjoys them for about 5 or 10 minutes, then he finds them overwhelming and really prefers being alone, doing nothing. And this is a problem more, in my perception, as a problem for the families than for the patient, because the patient really doesn't care. When I first started looking at fatigue, I was really struck by how common it is in Parkinson's disease. Back in the early days of this, that would be in the mid-1980s or so, not so long ago for some of us, when you talked about fatigue to a neurologist, the knee-jerk response was multiple sclerosis, because everybody knew at that time that fatigue is a very common symptom in multiple sclerosis. And one of my MS colleagues says that if a patient with MS or suspected MS does not complain of fatigue, it's automatically a red flag that goes up in his mind as to whether that patient truly does have Parkinson's disease. So in just a consecutive sequence of patients who I saw in my clinic, and this has been confirmed in other studies around the world, because fatigue, like a lot of behavioral aspects of virtually any disease, may certainly have major cultural differences, because different cultures may perceive a particular type of behavior problem as something that really has a tremendous amount of stigma associated with it, so that they won't talk about it, whereas others may not see that. So there may be differences, but this in fact seems to be worldwide. So 1/3 of consecutive patients in my clinic in Rhode Island listed fatigue as their single worst symptom in Parkinson's disease. 1/2 of the Parkinson patients listed fatigue as one of their 3 worst problems, and yet generally patients don't bring it up, okay? And fatigue epidemiology seems to be about the same around the world, and I think counterintuitively, although in general fatigue, as I'll say later, seems to get worse over time in general, fatigue is not directly related to motor severity, so that you will see patients early on with fatigue as one of their main symptoms, even though their degree of Parkinsonism and their Hoehn-Yahr stage may in fact be relatively low. The fatigue often predates motor symptoms, and it also counterintuitively does not improve with treatment of the motor symptoms or improvement in the motor symptoms. And as this man who I quoted at the beginning said, it's not related to depression. Fatigue often brings up the idea in the doctor, family as well, that fatigue and depression are synonymous. They are not, although they often are related. The problem with understanding fatigue in Parkinson's disease is that it's common in general. The only disorder I know of, and I may be wrong about this, of course, that's not associated with an increased prevalence of fatigue really is mania. So all of the other disorders, including psychiatric disorders and the variety of medical and neurological disorders, are all associated with increased fatigue, and often in a way that is somewhat counterintuitive. So in one study, for example, of Guillain-Barré syndrome, the patients with minor Guillain-Barré sequelae actually were more fatigued than the patients with more significant neurological deficits. So in studies, and there have been a large number of studies looking at fatigue in a variety of different syndromes, 10% of visits to a primary care provider are specifically for fatigue, or at least they list fatigue as the complaints that the patient had. 25% of patients who see primary care providers complain of fatigue, that is, if they're asked about it, fatigue is one of their symptoms. 75% of multiple sclerosis patients, and 90% of lupus patients. Is there anything specific about fatigue in Parkinson's disease? Well, not that's been found so far. So when a patient with Parkinson's disease has fatigue as that first patient, maybe it's related to depression, because depression often is associated with fatigue. But it may be related to other things as well, including apathy. And of course, Parkinson patients may have one or more of the various medical illnesses that are associated with fatigue. Congestive heart failure, anemia, any type of infection, COPD, diabetes, they're all associated with an increased risk of fatigue. Anxiety also is another problem that's common in Parkinson's disease that's associated with fatigue. Confounding this is the difficulty many patients have of separating fatigue from sleepiness. So in English, we use the word tired a lot. And patients will frequently say, well, I'm really tired. And when I ask them, is it sleepy tired or is it fatigued tired? Fatigue meaning lacking in energy. The way you feel after you've run a marathon, you're fatigued, you're not sleepy. If you haven't slept at night, you're sleepy, but not necessarily fatigued, although a lot of patients who are sleepy will complain that they're also fatigued, and it can be very difficult to tease out one thing from the other. In a study that was done by Richard Brown in England, where he interviewed a large number of patients with Parkinson's disease who complained of fatigue, the striking feature, I think, about fatigue is that it's an unpleasant sort of experience. The sensation is of tiredness, lack of energy, a sensation of exhaustion, and they distinguish the fatigue that they have with Parkinson's disease from the fatigue they had before they developed this problem, describing it as abnormally severe. It was often present all the time, but sometimes unpredictable in onset, duration, and it wasn't in all cases continuous. It was exacerbated by physical, emotional, and social stressors, and it was always an unpleasant experience, partly because it restricted their activity, but partly because it made them feel badly as they were experiencing it. And in all studies done around the world looking at quality of life in Parkinson's disease, fatigue is one of the syndromes that is usually seen. Making this even more complicated is the fact that we often think of fatigue as being divided into different types of fatigue. So there's an objective type of physiological fatigue that's seen, for example, in myasthenia gravis, where the muscle gives out. This is a different type of fatigue. Although this muscle giving out is also seen in Parkinson's disease, and that's the type of problem that actually is improved with levodopa. So if you measure muscle responses, repeated muscle responses in Parkinson patients before and after being given medications for the motor symptoms of Parkinson's, that improves, but the feeling of exhaustion that the patient has does not improve. So patients have difficulty initiating and sustaining mental and physical tasks, and sometimes we talk about physical fatigue where a patient has difficulty doing physical things. They have difficulty with inertia, getting up out of their chair to do something, getting up to participate in some sort of social event. Oftentimes they'll also describe mental fatigue where they have difficulty continuing to think about problems and they just try to withdraw and feel bothered by the fact that they can't push themselves to do things. Now, aside from fatigue being a sensation, just like we think of depression as being a feeling state where we're melancholic, you can also think of fatigue as a syndrome. So Benzie Kluger in Colorado has described a syndrome of fatigue, where of course a feeling of tiredness is part of it, but then you have to have symptoms for a certain period of time. The symptoms have to be severe enough that they interfere with your activity. So symptoms, I'm just going to read a few of these to you, may be induced by routine activities of daily living. They may occur with little or no exertion, and they limit your activities. So those of you who are interested, this has been published. This has not generally been accepted in any way by the Movement Disorder Society, as far as I'm aware, but I think it's a very good start for talking about doing interventional trials to try to treat fatigue, which is that it's a better way, I think, of conceptualizing fatigue in order to study it than simply asking patients whether or not they're fatigued, how tired they are, and how much it interferes with their activity, although those are important as well. And I remind you that when you define depression, as it is in the DSM, that depression requires a feeling state, but also an association with a number of cardinal features. You have to have 5 out of 9 cardinal features to have a syndrome of depression, one of which, of course, is fatigue. So people with depression or also fatigue. So what are the confounds for trying to study fatigue? Well, as I mentioned, sleepiness, but also depression, apathy, and anxiety, although anxiety is not listed here, plus the other disorders that people with Parkinson's disease have. As we age, we keep accumulating more and more disorders, and they include things like heart failure, autoimmune disorders, cancer, anemia, various organ failures, whether lungs, heart, or kidney, endocrine disorders, plus the various types of psychiatric disorders. Attempts to look at underpinnings of fatigue in Parkinson's disease or in other disorders have really turned up a variety of different isolated findings that are not yet confirmed. The study from Park West in Norway has turned up some abnormalities of various biomarkers for inflammation. This is data that was presented at a meeting. It has not yet been accepted for publication, and it's really only from one study and will need to be confirmed. We did an exercise study having the idea that perhaps people with fatigue and Parkinson's disease had a less efficient exercise physiology. So we took patients with Parkinson's disease with fatigue and those with Parkinson's disease who did not have fatigue, and we exercised them looking for difference in oxygen utilization for the various amounts of energy that they expended, and we found no difference.
The only differences that were found with using a variety of questionnaires was that the activity level, as you would guess, of people who have fatigue with Parkinson's is less than the activity level for people who don't. Some genetic studies have shown some possible links to different types of gene abnormalities in Parkinson's disease, but this has not been confirmed. The natural history of fatigue is in general for patients who are fatigued to continue being fatigued. That's not 100%, and because we define fatigue for these studies in terms of how they're scored on a questionnaire related to fatigue, that often, a change of a very small amount, if you define, say, a score of 4, which doesn't have to have any particular meaning, but a score of 4 on the fatigue severity scale, if you're 4.1, you're fatigued, if you're 3.9, you're not. So therefore, a lot of the variability has to do with just small fluctuations, plus the fact that people may or may not feel fatigued at the time of the questionnaire. But in general, fatigue tends to be present throughout the course of the disease and tends to get worse over time. So fatigue is a significant problem even early on. In the L-DOPA study, which is a study looking at, it's a double-blind placebo-controlled trial, looking at whether different amounts of L-DOPA, when given as the initial treatment for newly diagnosed people with Parkinson's disease, was associated with a difference in their disease progression. They also looked at fatigue. And at entry into that study, which is, again, people who volunteered, who were at academic centers, who were in a double-blind placebo-controlled trial shortly after their diagnosis, 1/3 of those people had significant complaints of fatigue. Fatigue is associated, as I said, with depression, apathy, or anxiety, and in general population, we think it's associated with these things in Parkinson's disease as well, and we really don't have physiological interpretations of this. Now, when I mentioned that fatigue is common in depression, I also mentioned that fatigue is one of the cardinal features that's used in diagnosing depression. So it's not surprising, of course, that it would be increased in depressed patients. What people don't realize about fatigue and depression is that even though it's associated, when you treat the depression, the fatigue doesn't always improve. In fact, significantly often it does not improve. And that's very similar, as I said, to what we see in Parkinson's disease. In the L-DOPA trial, there was mild improvement in fatigue when patients improved with their treatment in L-DOPA, but it wasn't really clinically significant, although it was statistically significant. But in these studies, even in responders, 72% here of men and 77% of women reported fatigue after receiving their treatment for depression. And in an American study, 38% of subjects who met criteria for response to fluoxetine Prozac still reported fatigue. So even in depressed patients who had fatigue, so you can think of your depressed Parkinson patients who have depression and fatigue, you may treat their depression, but you can't count on an improvement in depression being associated with also a depression, an improvement, in their sense of fatigue. Now, apathy also is common in Parkinson's disease, and I'll tell you, I was very surprised. I went to a meeting once on apathy, which was mainly with some geriatricians and people who specialize in Alzheimer's disease. And in talking about apathy, their opinion about apathy was really quite different than mine, and I don't know what, of course, people in the audience think. I had always viewed apathy in Parkinson's disease as, in general, being somewhat of a insulating sort of problem. It was actually not a bad thing for many of these Parkinson patients to develop apathy because they stopped caring very much. They weren't hurt, they weren't grieving necessarily for their loss of function. And of course, there's a large association between apathy and dementia in Parkinson's disease. Whereas the people who studied Alzheimer's disease considered apathy an extremely important and really debilitating kind of symptom for their patients. And so I don't know if I'm just odd in my interpretation of how this insulates patients. I think that apathy is more bothersome in general to the family of the patient because the personality has changed and they no longer have the spark and the personality that they had prior to their illness, but in some ways it's protective. We looked at fatigue, relationship between fatigue and apathy, and compared Parkinson patients. This is not this slide, I'm sorry. We looked at the difference between fatigue and apathy in MS patients and compared them to Parkinson patients. Since, as I said, fatigue is so highly correlated with our interpretation of what MS is like. And we found that although fatigue was somewhat more severe and a bit more common in multiple sclerosis patients than it was in Parkinson's disease, it really wasn't that much different, both in terms of the severity and in terms of the frequency. And both were associated with significant percentages or prevalence of apathy, and the correlation between apathy and fatigue in both syndromes was quite significant. In this study that was done, apathy affected 57, so over half, of consecutive Parkinson patients, and was correlated with fatigue. That was our study. And in another study, 23% of never treated Parkinson patients were found to have apathy, and of these, 73% were not depressed. So although apathy is associated with depression and Parkinson's disease, it's not always associated.
It can be seen without it. Depression, of course, you're all familiar with, is common in Parkinson's disease. It's not such an easy thing to study either, as all of the other behavior problems that we see in Parkinson's disease. There's a large confound because many of the problems that we see in depression are often seen in people with Parkinson's disease as part of their motor illness and not necessarily a separate kind of behavioral category. Psychomotor retardation, for example, is one of the cardinal features that's looked for in diagnosing Parkinson's disease. And of course, if you don't have psychomotor retardation, you don't have Parkinson's disease. So depression is common in Parkinson's, fatigue is associated with depression, and in a depressed patient, there is no syndromic definition, as Benzie-Kluger has proposed for fatigue in Parkinson's disease. So I will close here with 2 slides. And the conclusions are, number one, fatigue is very common in Parkinson's disease. It's something you should inquire about. Patients often will not volunteer it. Fatigue has not yet, and I doubt ever will be, shown to have a particular unique characteristic that will allow you to say, fatigue in this Parkinson patient means that is from their Parkinson's and is not from their depression or their heart failure or their cancer. Fatigue in Parkinson's may be related to depression, apathy, anxiety, or medical disorders, but treating these may not improve their fatigue. So in that patient who said he wasn't fatigued, but he should see a psychiatrist, he wasn't depressed, he was fatigued, he should see a psychiatrist. He's treating a psychiatrist, and even if he was depressed, might not help him. Recognizing fatigue, however, is very important, okay, because fatigue is often considered a moral failing by the family. He doesn't try, he's not doing anything for himself, he won't do his physical therapy, he won't go out for a walk, he won't socialize with people, he won't do this, he won't do that. And the burden is then on the patient. And while it's true the patient would do better if he did all of these things, it can be very difficult for patients with fatigue to do these things just because they are, in fact, fatigued. And I think recognizing this and sort of relieving some of the burden on the patient that's inflicted by the family and helping the family understand that this isn't a moral failing can be very important. Psychotherapy may be helpful for this, but it's not so easy to engage a patient in psychotherapy. So fatigue is common, but it's also common in the number of other disorders that are increased in prevalence among people with Parkinson's disease. Fatigue is an amotivational syndrome. Not always. Some patients complain that they're fatigued. Those are the ones who might complain to you without your asking about their fatigue because fatigue constrains their life. There are no particular distinguishing characteristics yet identified of fatigue in Parkinson's versus fatigue from other disorders. Treating the underlying syndrome may in fact not help their fatigue, so that's something you should know. And identifying fatigue as of this time is important primarily for counseling, that is the patient and the family, but we have not yet found any proven remedies for helping the patient feel better. Thank you very much.